Hey everyone, welcome back. Ready to explore something new.
Always up for a deep dive. What are we looking at today?
So, you know how we were talking about getting our eyes checked? Well, some of you sent in questions about cataracts.
Cataracts, a fascinating topic, and one we often don't fully understand until we or someone we know experiences them.
Exactly. We often think of it as just an old age thing. Things get a little blurry, get new glasses, no big deal, right?
Right. Except it's not always that simple.
Okay, so mission one for this deep dive. What are cataracts, really? Like beyond the my vision's a bit off level?
I like it getting right to the heart of it. Let's imagine your eye's lens is like a window, all right?
Okay, I could picture that.
So a cataract is basically like that window slowly getting foggier and foggier.
Foggier, interesting.
It's not that the screen at the back of your eye, the retina, is messed up. The picture itself is getting distorted before it even gets there.
So new glasses wouldn't really fix the root problem then, right?
Yeah,
That's a good distinction. I hadn't thought about it like that before.
you've got it. And unfortunately, in the US, they're the leading cause of vision loss. And even more impactful, globally, they're the #1 cause of preventable blindness.
Wow, preventable blindness. See, now that's what I mean by deep dive worthy. So it's not just an old folks issue then, even though I'm sure age plays a role.
It does, but here's where it gets even more interesting. High blood sugar, for example, is a major culprit in cataract development.
Because of diabetes, right. I knew there was the link there.
Exactly. When your blood sugar is consistently high, it can actually damage the tiny blood vessels in your retina, which obviously isn't good.
Right, makes sense.
And this impacts the retina's ability to receive those clear images. And it also affects the lens itself, making it more susceptible to that clouding we were just discussing.
So it's a double whammy for your eyes if you're not managing your diabetes. Yikes.
Exactly. And that's just one example. There are other risk factors besides age that might surprise you. For instance, certain medications.
Medications. Like,
Mhm.
well, I'm picturing people popping vitamin C like candy, but it's probably a bit more complicated than that.
Way more complicated.
Yeah.
Think about medications like corticosteroids, which are used for inflammation,
Okay, yeah, I've heard of those.
or even some diuretics. They can aptly influence the delicate balance of fluids in your eye, which can contribute to cataract formation.
Hold on. Even if you need those medications, it's like this side effect you might not even know about.
That's why those regular eye exams are so important, especially if you're over 40 or have any of those risk factors we mentioned.
So we're already talking prevention, early detection.
Mm.
But what about those early signs? Is it just blurry vision?
Mm.
Or are there other things going on?
Well, blurry vision is a big one, but it's not always so in your face. You know how colors in old photographs, they kind of fade over time? It's a bit like that.
Really? I've never thought about it like that, but it makes sense. Like the world's a little less vibrant.
Exactly. Things might seem duller, almost washed out, and you might find yourself needing more light to read, or squinting more often. Some people have trouble with certain colors, especially blues and purples.
And this whole time you're thinking, man, I think I need a better reading lamp. I bet a lot of people miss those signs.
All the time. It's gradual, so people adjust without realizing. And it's not just colors and stuff. Some people get halos around lights, especially at night, which is kind of freaky.
Especially when you're driving.
Yeah.
Okay, yeah, now it's not just needing new glasses.
It's a safety thing, for sure. Another reason why catching it early is so important, it's not like it happens overnight. So those regular eye exams, can't stress that enough.
So let's say you go in, maybe you've noticed some things, maybe you're just being proactive. What happens? Is it the puff of air in your eye test?
That's glaucoma, actually, a different story. For cataracts, they'll probably start with a visual acuity test. You know, the read the letters thing.
Classic. So far, so good. What else?
Well, they need to see the lens itself. That's where the cataract is. They use a microscope called a slit lamp.
A slit lamp.
Yeah.
Sounds intense.
It lets them see the structures at the front of your eye, like super detailed. They might use eye drops to dilate your pupils, too.
To see the retina in the back, right?
Yeah.
Make sure everything's working back there. Let's say they do all that, and it's cataracts. Is surgery automatic at that point?
Not at all. That's a big question I get. Early on, lifestyle changes can make a difference.
A lifestyle changes, huh? So like eating carrots and wearing sunglasses even when it's cloudy.
Well, you laugh, but protecting your eyes from UV rays is huge. Think of sunglasses like sunscreen for your eyes. It's your first line of defense, really.
Sunglasses, check. What else is there?
If you have other things going on like diabetes, that's where managing those conditions is even more important. Keeping your blood sugar stable can really slow down how fast cataracts develop.
Makes sense. We already talked about how bad high blood sugar is for the blood vessels in your eyes. So it's not just your eyes, it's everything working together.
Exactly. There's no magic solution, but those healthy habits, they all add up, especially in those early stages.
It's nice to know you've got some control at least, right? But sometimes those lifestyle things aren't enough. When does surgery come into play?
Usually when a cataract starts messing with your everyday life, like if you're avoiding driving at night or struggling to read or you can't enjoy your hobbies because of your vision, that's when it's time to talk to your eye doctor about surgery.
From what I've read, cataract surgery is one of the safest and most common surgeries in the U.S. It's going to be reassuring, right?
Yeah, absolutely. And with all the advances in technology, there are really high success rates these days. The two main types of surgery you might hear about are phacoemulsification and laser surgery.
Phaco what now? Those are some big words.
I know, right? So phacoemulsification uses ultrasound. Basically, the ultrasound waves break up the cloudy lens into tiny pieces.
Okay, so then what happens to those tiny pieces?
They're gently suctioned out. And then the surgeon takes out your natural lens, which is now cloudy, and replaces it with a new, clear, artificial lens. It's really incredible when you think about it.
Like you're literally swapping out a foggy window for a brand new pane of glass.
Perfect analogy. Now, laser surgery is similar in that it has the same goal, but instead of ultrasound, it uses a laser, a very focused laser, to break up the cataract. Both are very effective, though, and your ophthalmologist will help you figure out which one makes the most sense for you.
Got it. It's good to know they have options. Now, what about that other type of surgery from the research? Extracapsular cataract extraction. What is that?
Good catch. Yeah, it's not as common these days. They usually save that technique for more complicated cases where the cataract is really dense or big. It involves taking out the whole cataract in one piece through a slightly larger incision.
So not as routine as the other two.
Right.
So you have surgery, get a new lens. Crystal clear vision for life.
That's the hope. 9 out of 10 people see a big improvement in their vision after surgery.
9 out of 10. Those are good odds.
They really are. But there is a chance of something called a secondary cataract developing.
A secondary cataract. That sounds kind of scary. Like the sequel nobody asked for.
It's not as bad as it sounds. Basically, sometimes a cloudy layer can form on the capsule that holds the new lens.
So it's not the original cataract coming back.
No. Think of it like scar tissue. But the good news is, if it happens, it's easily treatable with a laser procedure.
That is good news. This whole cataract thing is a lot more manageable than I thought. Knowledge is power, as they say. Knowing the risk factors, what to look out for, and the treatment options. It really puts you in the driver's seat.
Absolutely. Cataracts don't have to mean the end of clear sight, that's for sure. And the more we know and the more proactive we are about our eye health, the better.
I love that. Proactive, not panicky. Say, great takeaway from this whole deep dive. So I don't know about you, but I'm thinking, okay, what's one thing I can do differently to take care of my eyes? Maybe it's finally making that eye appointment. Maybe it's just wearing sunglasses more often. Whatever it is, small changes can make a big difference. And hey, share what you learned today. Tell a friend about what we talked about. Until next time, deep divers.